first, we have Annalisa Burgos. She is a KITV anchor and reporter. We have Eleni Avendaño from Honolulu Civil Beat. She is a health reporter. We have Ashley Mizuo. She is a City Hall reporter at the Honolulu Star-Advertiser, but she is also formerly a reporter for Hawaii Public Radio and a million other Hawaii outlets. So I'm gonna allow these panelists to give a more detailed introduction of themselves. So Annalisa, do you want to go ahead first?
Yeah, sure. So, hey, everybody. I know some of you. I am relatively new to Hawaii. I've been here a couple years now, and I work for the ABC affiliate here in Honolulu. And so before that, I worked in different cities. I was in Asia for 7 years. And then before that, I was in New York for a really long time. And my background is usually business journalism, finance reporting, international news. But when I moved here and COVID hit, that became essentially the big focus of the reporting here. So I'm excited to meet more people. I've been very active in AAJA for many, many years in every city I've lived in. And I consider this like a family. So I'm sad that I haven't been able to see a lot of you here in Hawaii yet, just because of COVID and all of that. But yeah, I'm looking forward to hearing what you guys want to talk about, and as far as sharing how we cover this like new normal that we always talk about, right? So
thank you so much. Next up, we have Eleni Avendaño.
Aloha. I have been with Civil Beat for going on 2 years now through a fellowship through a program called Report for America. And so it was great to be able to come home, and Civil Beat could have chosen any beat under the sun, and they chose public health. And that turned out to be pretty good timing because the pandemic hit a couple months later. So I did have some background reporting on health for Pacific Business News. But other than that, I think it's been definitely a huge growing experience having COVID as my full-time beat. And happy to be here with you all and chat more.
Thank you so much, Eleni. And next up, we have Ashley.
Hi, I'm Ashley. I am the City Hall reporter at the Honolulu Star-Advertiser. Although it's a relatively new position, I've been there for about 2.5 months. But before that, for most of the pandemic, I was working for Hawaii Public Radio, covering COVID and education. Simultaneously. Most of my background is in government reporting. So jumping into covering COVID and education was really exciting and super crazy. So really glad to talk about it. Thanks for everyone being here.
Thank you so much, Ashley. So what we're gonna do is we're gonna start with some panel questions. And so I will be asking the questions and the panelists will answer them. And then we'll move on to the audience questions, and we can talk more freely about the things that you guys want to talk about. I do want to remind everyone that this event is being recorded. So if you're thinking about doing anything crazy, don't, or saying anything offensive, don't. And then we'll leave it at that. So we got quite a list of questions here today, but the first one we really wanted to tackle is, how has your job changed in the pandemic? What different reporting strategies are you using, and how's your workflow changed? Who wants to go first? I will pick on Eleni.
I guess you have to pick on someone.
I have Eleni. Do you have an answer for us?
Yeah. I was going to volunteer to go first and just keep it short and then pass it on to them. But I think the obvious thing is that we weren't able to go to scenes in person. We couldn't do in-person interviews. I switched pretty much to phone or Zoom interviews, and it definitely takes a toll on sort of the interviewee-interviewer relationship. Another thing that I was thinking about, I was just thinking back to exactly a year ago when we would sign into the governor's press conferences and the Zoom calls, and I just remember being so grateful that Ashley was tuning in too, because if they had technical difficulties, I could text her and be like, are you seeing this? And, you know, it was really frustrating though, because even if we were to take certain precautions, we couldn't go ask questions in person. And so because of that, oftentimes the responses in a Zoom call, you know, public officials can just kind of keep it brief, and it's much harder to hold them accountable and ask follow-up questions when folks at the actual press conference say, okay, next reporter, next question, and they're trying to go down the list of all the reporters in attendance. So those were the major changes for sure. You guys want to add anything?
Yeah.
Sorry, Ashley. Maybe this is something you can address in what you're adding, but for the audience who are not actually media professionals, like, could you guys tell us how the press conferences changed, governor or city or otherwise?
Yeah. So normally at a press conference, right, you would go in person and they would have like the governor up there with like the health director. So this is kind of how the COVID press conferences started off, was with, you know, a Governor Ige, and then health director at the time, Bruce Anderson, would be sitting up there, and, you know, they do like their opening remarks and then say what they want to say. And then it's kind of just like open season for reporters to just kind of like yell out what they want to ask. And you like try to, like, everyone's pretty nice and you like raise your hand or like signal. But generally speaking, like if you are asking something and they don't give you an answer, you can continue to be like, okay, well, I don't think that you answered the question, or kind of interject. But once we switched to Zoom, they just mute you. Like you get your one question, then you're muted. Or they'll be like, we're only accepting via text message. And if it's not strictly on topic, they'll be like, well, no off topic questions. So we're not even gonna ask that next. But if we were in person, obviously you could just at least like yell it out, and they would have to in public choose to ignore your question. And that kind of accountability was just like totally taken away and tossed out the window. So, and it also made you have to really try to ask as many questions in one question as possible. So if anyone was tuning into those press conferences, you would hear all of us like asking like 5 questions in a disguise of one question, because you only got one shot to do it. Yeah.
Annalisa isn't good for anyone. Go ahead.
Yeah, I was just gonna add to that same. I was so frustrated, you know, when you wanted to ask other questions, but they wouldn't let you. You know, they basically controlled who got to ask it. So like, I'd be on this Zoom, and I'd like, you know, they want you to raise your hand or something, or text your questions ahead of time. And then, you know, it's up to them. They control who gets to ask a question. And if they don't have any time, they don't get to your question. So that really was annoying. And then I think the aspect of, you know, ambushing people and being, you know, at a place and asking people, as a TV reporter. So I work for a TV station, and that aspect, I think I missed also, because you could actually get people to talk if you actually have a camera in their face, or you're more, you know, you can actually get them, as opposed to trying to schedule a Zoom or schedule something, and they're just less likely. So I just feel like it wasn't as transparent, and it was just more difficult to get people, you know, to answer questions, especially early on when there was a lot of criticism on how the Department of Health was handling things, and our numbers had been spiking. So I don't know what it was like before, but during this period, it was just so difficult to get officials to answer difficult questions.
And so that leads nicely into our next question. So something, if the audience members don't know, with the emergency proclamation during the pandemic, there came a suspension of the public records law, which is the Uniformed Information, what is it, Protection Act?
Yeah.
Yes. So UIPA is what we call it. So the public records law was suspended. So how did that affect your guys' work? And if you have any specific examples of stories what you were trying to do regarding the pandemic where you couldn't get information because of the suspension, you should add those.
Yeah, I made it really difficult. Like one thing that, like the suspension was in that usually if you submit a information request, they must respond in a certain amount of time, but that suspension was like, they have an indefinite amount of time to respond. It often felt kind of like you're just yelling into nothingness. For example, there was a big outbreak at Maui Medical Memorial, the hospital in the very beginning. That was like one of the first big outbreaks at the hospital. And you can request for email correspondence, and I had requested pretty specific dates because if you try to narrow it down as far as possible so that they can like send you back the emails. But I was curious about the kind of conversations they were having about inspections because there's like a lot of back and forth and confusion over like what they were inspecting, if they knew about the problem beforehand and whatnot. So I had information requested it, and basically they were kind of just like, okay, it's in the queue, but like, as you know, it's suspended. So don't hold your breath, essentially. And that kind of has just been how it's been for like anything, like even not related to COVID. Like I don't even feel as though it's even worth my time sometimes to even do a records request, because you're better off just like asking the spokesperson or whoever and like kind of like trying to get them to get you that information in like a more roundabout way, which has been super difficult.
Annalisa, do you have anything to add?
As far as the access to information, I just felt like whenever I would ask a PIO or a source within the department to get stats, I just felt that there wasn't any urgency or even access to this stuff. Like I almost felt like the data wasn't being created, right? Like early on, it wasn't available. So it was very, very frustrating in the beginning. Remember when we were trying to get stats and data of all these outbreaks and all these things, and then it got better. Obviously now they have this dashboard, and they are able to do more metrics. But I just remember early on, it's just like during these press conferences, we'd want more, like how are they coming up with these restrictions, right? It's like they had these like tiers downs, but none of it was driven by concrete data that we could report. And I don't know, to me, it was just frustrating. And I just didn't feel like there was any urgency, like you said, when with this suspension of that, they just hid behind it. So.
Eleni, do you have any thoughts?
That just kind of brought to mind how difficult it is to get at least phone interviews with head officials. And it seems that the norm is now that the PIOs or the communications officials will try to do the interview themselves, which when you're in a pinch, that's totally fine. That's their job. And usually they say, at least for the Department of Health, if I was trying to get an interview with the state epidemiologist, it could take weeks because they're very busy, and I know they're very busy. But there's ways to work around it, and that was just another barrier to getting information, especially when you're able to, get the best information when you get to talk one-on-one. So that's all I would add.
So speaking of Department of Health leadership, which you mentioned earlier, that leadership structure looks very different now than it did a year ago. I mean, Dr. Sarah Park, who is the state epidemiologist, she's no longer around. Director Bruce Anderson has been replaced, among other changes. So what do you think the department could have done differently, especially earlier in the pandemic, to create more public trust?
I think that they should have just, I think there are a lot of things that they were doing to try to strategize to not cause extreme alarm or to not cause panic, which I can understand from their perspective, them trying to not send everyone into a frenzy. But in doing that, they also concealed a lot of information or would just be extremely unwilling to talk to the press in general. I think they felt as though media was really beating them up and they just didn't want to deal with it anymore, but that just made everyone more aggressive. Like if they had just been more transparent and given people the information that we had been asking for from the start, it would be like easy things to like the biggest one that I can think of is like the contact tracing conundrum, where we were always like, okay, are we contact tracing? How many people do you have contact tracing? And they would be very evasive in the number. And then at one point said they had hundreds of contact tracers, when in reality they had like literally 10. And things like that are just so easy to find out. First of all, like it's so easy for a reporter to go discover that you're lying about something like that. And also it just totally erodes public trust. And so like, even if the information isn't great, it's always better, like it would have been better for them to just be transparent about things not being good than to try to control the situation by concealing information.
Anybody else have any thoughts on that?
She covered it.
I also, I'm the moderator, but if I were to add something, I think the biggest change after the leadership change was like the attitude, because I'm a data reporter at Civil Beat, the kinds of data that were available to the public dramatically changed after Dr. Sarah Park left. And I'm not saying that she was responsible for information being concealed, and of course not single-handedly responsible, but before I did notice that the DOH had an attitude where the less we share is better, and the less data we give out is better, but that clearly turned out not to be true. So I want to switch gears a little bit and ask about if you guys had any safety concerns or any incidents involving the threat to the virus. I'm going to pick on you, Annalisa.
You mean safety as far as whether when I was out, I would get it?
Safety for yourself and your team.
Personally, like I was okay with being out. Like early on, I covered testing sites, right? When they were doing these drive-through, when they did that surge testing, like I wanted to be out there. I wanted to, you know, show that there was interest in these types of services for people, right? Because people wanted to get tested. Personally, like, yeah, I there were situations where social distancing wasn't practiced, right? When they had those really long lines at those testing sites. At the time, masks, I'm trying to remember, we weren't really forcing people to wear masks yet. So not everyone was wearing them. We had to, so we had our own mandate where we had to wear them all the time. But people would, you know, people were very quick to police us, especially on TV. They would be like, oh, she's not wearing her mask. There's no social distancing there. So I think I appreciated that, where people were at least reminding people, the reporters as well as the public, to stand by those mandates. But personally, I just thought it was like the hazard of the job. If you're going to go out and tell these people's stories, I talked to people who were positive, who tested positive, or like people who were waiting or quarantined, right? And you just kind of do your best. Like I kind of stayed away from, what is it, the 6 feet distance. And I did the best I could, but I felt like that was just part of, of the reporting.
Anybody else want to chime in?
I think just the the like quick nature of how things can change was really alarming. What comes to mind is just like the very last press conference that we had in the Department of Health before the lockdown. Like I was sitting right next, like pretty close to Eleni and like the other reporters. Like no one was wearing a mask at the time because that guidance then was that masks were bad or like you shouldn't be using them. And like 2 days later, we were in full lockdown, and I was thinking back to that we were in a room with literally every single important political director maskless, and then in 2 days it was like boom, we're in lockdown. And that's just like the nature of reporting on the pandemic, was just like super quick changes. Like one day the guidance is this, the next day is something totally different. So that was the only, yeah.
Eleni, did you have any thoughts?
No, I mean, you guys were definitely out on the town much more than I, because that's part of your jobs, and that's, you know, Civil Beat's an online newspapers. So for the most part, I was able to work from home. So that was definitely a privilege.
All right, well, thank you for your answers. And so during the pandemic, a lot of us journalists faced lots of pandemic fatigue because our workloads were greater than ever, almost, depending on what your job is. But I think everyone on this panel might have experienced some of that workload and fatigue. How do you balance your professional life? Like, how did you balance your personal life during this time, and what helped you?
I can go first on that because I'm a
Sure.
mom and I have 2 children who are distance learning. I also have a husband who used to travel frequently. So it was stressful. So whatever we covered in terms of people's lives being disrupted because of the pandemic, I was experiencing it also. And it was just, you know, especially when we cover stories about the schools and just people's people just frustrated that they don't have childcare and having to work and having to like take time off because they can't deal, right? And so I was experiencing that as well. And yeah, it just it was hard to balance that. But and then you're talking, you know, then you cover stories about mental health and people that lose their jobs, and you're just lucky that you have a job. And then you know, it's just like, then you talk to all these just really sad stories of people. So if anything, it did make me feel grateful, you know, that I was still employed and that you know, my kids are safe and all this stuff. But at the same time, when you're out there talking to everyone else, it's like, oh my gosh, it's just so devastating. And you know, and that I think that actually helped me kind of think, okay, well, how can I share this a little bit more and raise more awareness and make people care a little bit more, like the officials do more because of that. So yeah, it was difficult. It still is a little bit difficult, but you know, it's our job.
Do you have anyone else chiming in? Yes.
Yeah, I know I just said working from home was a privilege, but it also meant that I was, you know, working pretty much at all hours and much later hours, especially, you know, when this all began. I was working till like 8 or 9 or sometimes later. And, you know, it just became a really overwhelming treadmill of sorts. So it wasn't, I mean, it like Ashley said, you know, things kept on changing really quickly and stuff didn't really slow down per se. But it got to a point where I was like, okay, I really need to stay sane if I'm going to survive this. So, you know, just doing little things in the morning, trying to take at least like 15 minutes to do quick yoga or like a stretching routine or something, like anything to like start the day off right and just take a deep breath and be like, okay, here we go. And that really helped, I think.
Yeah, totally same thing. Just yeah, the long hours, like working on weekends, that I wouldn't usually be working on weekends. It would be like you turn in the copy and then by the time the next day comes, it's outdated and you gotta like go in early and change it and fix it or fix it in the middle of the night. So yeah, I was really trying to like set those boundaries at work too. Like in the beginning, it was okay because I thought it was just like, oh, it's only be a few months of this like craziness, but then it just like went on and on and on and on and on. So yeah, kind of like learning. It really taught me quickly how to set boundaries at work, to just be like, okay, like we're gonna do our best, but we're not gonna get everything all the time because it's impossible. And we're just one person. So yeah.
Thank you for your answers. I did want to ask from all of our panelists if they have a story that was the most memorable during the pandemic for whatever reasons. It was the most challenging or most heartbreaking or most, fun even. I don't know if a story can be fun during COVID, but a story that about the pandemic that you did that sticks out in your mind. And then if you could also share how you reported that story, that would be great. We'll just go in order. Annalisa, do you want to go ahead?
Yeah, sure. So yeah, early on, I felt like it was difficult to find survivors, like people who tested positive. There was this stigma associated with having COVID. And so, while we saw a lot of stories across the country with people, like in hospitals, like the frontline workers who were, having to hold people's hands as they die, those kind of compelling stories I'd see people do on the mainland. I felt like I want to do them here, but it was really hard to get people to talk openly about it. So I met this one woman who lived in Kalihi, and she agreed to share her story, but she didn't want to be identified. So we shot her from the back. And she just felt like abandoned. Like, so the story that we did this was in the heat of the whole contact tracing and how people were upset that DOH wasn't doing enough to get to these people. Kalihi was also going through this huge outbreak. Like there were cases popping up everywhere. And so and I just felt like there needed to be a voice for that community. So I met this woman, and she said how her entire family had gotten it. She didn't have it yet, but she was crying, and she was saying, the Department of Health has abandoned us. Like, we haven't gotten a call. My dad's gonna die. This was like at the very beginning, right, when people just didn't know that much about the disease yet, and they felt like the hospitals were overwhelmed. And yeah, so it was just really, it was heartbreaking for her and for me to listen to that, because it's like, yeah, this is why, people are upset with DOH at the time. It's just they weren't contacting people like them. They just felt like, they would test positive and send them home. They didn't have the quarantine hotel yet, that service. None of those services were up yet, where, they finally got the isolation service for people who couldn't do it in those multi-generational households. So she lived in a multi-generational household, and everyone was getting testing positive. So anyway, stuff like that, like, I think was really hard to come by, but I found that the most memorable.
Sorry, can you explain how it might be helpful to kind of explain to people maybe like how you went about finding a person like that?
Yeah, so you just have to, I don't know if you guys do this too, but you have to befriend all the doctors. So I would, I made contacts with council members. This woman actually was referred to me by Council Member Manahan. So he had said that he knew this woman. And so, but, he had to ask her permission first. And I said, sure. And so I had to work her a little bit, because she didn't want to be on record at first. But she finally agreed, because I explained to her, I said, there's a lot of people going through this like you. And so she felt like it was a bigger purpose that she was doing. So she agreed. But yeah, it's like your contacts, right? Like I called doctors. There's a bunch of organizations that are advocates for the community, right? Like community advocates that are trying to get more access. Right now it's about vaccines. So they're trying to get more access to vaccines for these dense communities. But yeah, it's a little bit hard. You just have to, I just kept calling people, being like, anyone know anyone? And, but yeah.
Thank you. Ashley, do you want to share your memorable story?
Yeah, I think the most memorable for me, because it was super frustrating was I did a story. I was curious about, who the police were arresting when the stay-at-home order went into effect, because they were, it was a law and people were getting arrested and cited for like being outside. I was just curious, and the way you can go about finding that out is arrest logs are outside of the police office, and it's also posted online every 2 weeks or so. So I started working on the story in May, and I was just like, oh, can you send me all of the police logs? Well, I originally asked for the exact, oh, can you tell me how many people were arrested for the code that the law is? And they were like, no, we will not. Or like, we can't do that, that's not possible. They're like, you can go and just look through all of the arrest logs yourself. So look through every single person we've arrested over the past, I think at that point it had been 4 months, and sift through that yourself. But they only have the past month out on display on display, but in a binder outside of the police department. And anything from beyond that, you have to ask them for. And they were trying to charge us I think it was $300 or $400 to get these records that are literally outside the police department at one point, every month. And so eventually, after I pestered them for weeks and weeks and weeks, they said that they would allow me to sit outside of the police station with my mask on and not take any of the papers home, or I couldn't take it and copy it, and go through every single arrest to go figure out who was getting arrested. And it turned out that disproportionately Micronesian people and Black people were being arrested by the police department. And it was just really frustrating, the lack of accessibility, the lack of transparency, and in the end, it's just really difficult to get that information that's just really clear public record. And I just felt like it was such a violation of transparency to hide that information, or make it so difficult to find something like that. But yeah.
So that's actually one of the tactics that lots of agencies use to hinder reporters from getting records, because I used to be the criminal justice reporter and literally sat outside in that same chair that Ashley probably sat in to go through paper copies of things that the paper copies were printed from something. So presumably it exists in electronic format. And especially with the arrest logs, that came from a spreadsheet. Maybe it was from a proprietary software, but if your software does not have the function to export to formats that are more familiar to other people, then you shouldn't be using that one. But what the pandemic did is it actually really accentuated the antiquated infrastructure of the state and cities' IT systems and data collection systems. But that side note aside, Eleni, would you share your memorable story?
Preach. Yeah, I guess I'll try to end on a sort of more happy memory tone, although it's not actually that happy. But I really enjoyed trying to find sort of the tangential effects of the pandemic. So one story that I was proud of was looking at how the reports for child abuse were changing during the pandemic while the students were out of school. So when school's out, there goes sort of a reliable system for flagging abuse, which is teachers who can notice things. So I was able to get some records from the Department of Human Services to look into those trends. And so we did see the reports of possible abuse go down. That obviously doesn't mean that abuse disappeared overnight, but other sort of interesting trends kind of came from that. We noticed that more neighbors and relatives were calling DHS. And so as more people were staying home, there were sort of other ways where, community members were kind of looking out for each other. Yeah, that's the one I'll share.
Thank you, Eleni. So with that all being said, you guys did a spectrum of COVID related stories. Could you talk about all the different types of stories that you did during the pandemic regarding what issues across what beats, and how that's different from your daily job? Ashley, I'm picking on you.
Okay. Yeah, at HPR, we were a really small operation. There were only about 5 of us. Yeah, about 5 people who work there that are full-time reporters. So we have to cover a lot. I was general assignment. So I actually got thrown on COVID almost by accident. Someone was just out that day who would have normally gone to a press conference about a strange Chinese virus from China that was coming here. But I was just there and I was like, oh, I didn't have anything to do that day. So I went, and then that was just kind of solidified my beat on that. And COVID, the crazy thing about it is it just spreads so many legs. Like, you're interviewing businesses who are closed and like hurting for business, and then you're also interviewing people. Like, I did a lot of reporting about distance learning, like students trying to connect to the internet and they don't have internet, so they can't learn and they're falling further and further behind. Teachers who are just like so overwhelmed, and then you have the whole health aspect of it all, where you're asking the health department, who's getting sick, who are you testing people, and it just spreads so many legs. Whereas usually if you have a normal beat like where I'm at now, I would just be covering, the mayor and city hall, which is what I cover now, and it wouldn't be such a massive, all-consuming thing that touches every single aspect of every beat. So yeah.
Anybody else want to add?
I'll say that, I think with the public health beat, I was focused on looking at kind of community health and that sort of thing. So then when COVID hit, obviously I don't have a medical degree. And all of a sudden you are trying to learn as much as you can about, very scientific medical things. And so, thinking back to covering the discussion about starting a pre-travel testing program and what's a PCR test and that sort of thing. And it was really important to, make sure that you had sources that you could rely on who are experts in these things that can explain it to you, so then you can, make it understandable for the general community. But I think, that definitely sort of stretched what my beat would have been traditionally, I think. And I'm still not an expert, but it's definitely been a great learning experience. I think everybody during this pandemic has been becoming a virologist themselves, trying to take in
without the
everything.
medical degrees. Annalisa, did you want to add anything?
Just, I had a similar experience as they did, where I'm supposed to be like general assignment also, but everything under the sun that touched COVID became, a part of what I was working on. So schools, any kind of arrests, right? Violation of quarantine. I became, it's like, did we all interview Angela Keene at one point in the Quarantine Breakers, right? Like when we got tourists going wild. I remember, that was a memorable story. I forgot about that. There was this Filipino AAJA, like this social media influencer who essentially bragged on her social media that she had broken quarantine. She confessed that she had broken quarantine while she was here. And she had said that the police told her that she could do it because as long as she showed a negative COVID-19 test. So, and how that happened was, I forgot what happened. I think someone messaged it to me, and it was in Tagalog, which is the Filipino language, the main Filipino language. And so I translated it, and then I said, and then the AG had said, "Is this true?" And I said, "Yeah, she totally confessed in her video," and they arrested her. So, but if she had not done that on her social media and bragged, she probably would have been fine. No one would have noticed. But that's what I'm saying. Like those are the kind of stories that happen. I was like on the quarantine beat for a while.
Yeah, since you mentioned social media, and by the way, there were lots of people bragging, and the quarantine breakers would make screenshots of people on social media bragging about breaking quarantine. But so social media was definitely a tool. So I wanted to ask, what did you guys think were the most helpful resources or tools in reporting on the pandemic, whether that's like an organization person or something like social media or even a software? Who wants to go? Picking on Ashley.
I think what the pandemic showed me, I guess this kind of doesn't really answer the question, but what it did show me was the intense need to be, not necessarily, but like to form a good relationship with the spokespeople, because if they, not if they like you, but if you're fair with them most of the time, or if you can show them that you are seeing them as like a human being, not just like an information machine, they will sometimes help you out or give you some information that you're looking for. And I didn't realize, how important it was. I mean, I did realize, but it just more acutely felt like that relationship, especially because it was so tense at the time. Because you'd be like sending them emails and they're not responding to you, and trying to walk that line of being like, hey, respond to my email, give me this information, but also recognizing like, okay, I know that you're really busy, like you're just one spokesperson and you're getting like dozens and dozens and dozens of requests a day. So I can empathize with that, and trying to like humanize that relationship was really eye-opening, and I felt like it was really helpful. Yeah.
Eleni, do you want to go next?
I was gonna say Facebook groups actually were really helpful in my reporting this past year. Thinking about like unemployment support groups, doctors groups, and that sort of thing. So if you guys are in journalism, that's something to definitely tap into. And even I remember, I can't remember if we covered this. Actually, I think it was our colleague who found a video on TikTok that I guess sort of went viral, but it was a young hotel staff worker, and she was just explaining what it was like to be a hotel worker during the pandemic, and her concerns about the lack of like cleaning going on, and also how tourists weren't wearing masks or anything. And so maybe TikTok will become a even greater resource, who knows.
Annalisa?
I just, are we talking about the use of social media in our reporting and how it's changed?
Or what you found to be most resourceful in reporting on the pandemic, whether that's a tool or a person or group?
Yeah, no, I agree with what they already said, which was Facebook groups, especially with unemployment, finding those voices where people, they have that huge support group that, because we weren't getting a lot of answers from DLIR for a while, and this was early on. So at least having that group to talk to and find voices. And I think the administrator, we've interviewed her a couple times for I've done it for our shows. And yeah, because sometimes you just need someone to talk about the unemployment, and you can't get the PIO. Is there even a PIO for DLIR? I can't. Oh, it's Bill. It's Bill Kuntzman or something. But he doesn't usually. That's what I noticed too. Like when you can't get the director, you can't usually get the PIO to talk, which I thought that was strange, because in other places I've worked, the press person will actually be okay to do interviews. And here I noticed that they don't really do that. So I found that odd. I don't know if you guys, is it just the way it is here? That the PIOs don't usually do the
I think
interviews?
it depends on the agency, but
Mm.
for the most part, it does seem like there's a reluctance from the public information officers to actually conduct the interviews or do the interviews.
Yeah, because usually I'd want the director, right? But in many cases, if they can't get it, it would be nice to at least have the spokesperson. But
Right.
yeah.
Before we move on to the question and answers portion, we're going to have one last question to kind of wrap things up. So this past year featured a flurry of breaking news alerts, daily COVID case count updates. People had dashboards, email blasts. From a journalist perspective, though, what benefit do you think that provided to the public's understanding of this pandemic overall? And do you think there were any downsides to that constant flow of information and, the constant news cycle? And, what did it teach you about what the public wants from the media? Should we go in the same order? Ashley?
Yeah. I think I do think in the beginning, when COVID cases were kind of an anomaly or more news breaking, where it wasn't like every single day there were more and more cases, I thought that maybe it was a little more helpful. But one thing that I got really frustrated about that I kind of I had to say something was that, every single day people would be like, there are this many cases, like we're at 1,000 cases of COVID. And I was like, well, maybe that means that 1,000 people have been tested positive for COVID, but that number, like how many active cases of like COVID are there? And I thought that that number was a lot more helpful, or should have been a lot more helpful for people. And that number wasn't really recorded or shared, because like when you see, like now when you get like, I don't know, whatever the news alert was today, however many thousands and thousand number that we're up to, that number can just seem really daunting and depressing and kind of scary. And sometimes I think it caused extreme alarm when, yes, it's a serious matter, and yes, we're in a pandemic, and yes, it's scary, but I think sometimes the overabundance of news alerts really freaked people out, more so than give them information. Or like if you wanted to know the number of cases, if it's on like your website, I'm not sure if it needed to be, or it still needs to be like a push notification every single day, because it's just not healthy, I don't think, for people to be constantly thinking about 100 cases today, 99 cases yesterday. Like, yeah, that was my opinion about it.
Next up is Eleni.
Yeah, I agree with Ashley. I was thinking back to when it all began, we actually ran like a Q&A section because we were getting so many reader questions and inquiries and requests. Can you find out the answer to this or whatever? So we had that Q&A section, and then that developed into writing a daily post about the daily counts, and then also trying to incorporate any other sort of context or news of that day, besides being like really draining to have to write that story every day and how that takes away from your time reporting on other stuff. I guess on the one hand it was important to try to keep track of things in case there were any discrepancies by the agencies reporting these, and then also to be able to come up with our own graphics and sort of look at the trends and that sort of thing. But I don't ultimately, I wanted to share with you guys, Civil Beat decided to stop posting a daily COVID count story. And then instead, I am writing a weekly sort of wrap up instead. So looking at the cluster report that's put out by DOH every Thursday, and kind of looking at the trends, and then trying to incorporate any other sort of, timely news developments related to the COVID beat. So I went from writing, a story a day to once a week. So I think this is constantly evolving. But I totally agree with Ashley. I don't think it was good for anyone's mental health to focus on the daily numbers, because that's also not how epidemiologists look at things either.
Thank you, Eleni. Annalisa?
I think early on, people wanted to hear the numbers. They kind of saw it as a way of keeping track of how the Department of Health maybe was containing things. So, and I see that Ryan is in our panel. So his maps were super helpful early on in terms of zip codes. And, because when you get these stats, they're just so, they're numbers, right? And you just, it's nice to be able to visualize. So I do appreciate, you guys that do data visualization, because especially for TV, people want to see, like, early on, they're like, where are these numbers coming from? Like, which neighborhoods? And then when you have a map like that, then you can actually see it really easily. And then you were raising awareness that, yes, Kalihi was really hit hard, right? Or certain areas were hotspots, and also on the neighbor islands also, so that I thought that was important for early on, and our viewers wanted to see that. Now, yeah, I kind of personally, like, I don't see the relevancy of a daily report, but we do bring it out because it is news, so we report it. But yeah, in terms of context, I think it's better to focus on the clusters and the hospitalization rates and the positivity rates. I think that's more, active cases, same thing. So we do include those numbers as well, in addition to the numbers that the DOH releases.
Thank you.
From a record keeping standpoint, just to add, what I think what Annalisa's TV station does is actually pretty important in terms of like record keeping too, because now we'll have that archive and we can rely on you guys and the fact that you did post it every day. So I think that'll come in handy, one day when researchers are looking back, what happened in Hawaii?
Right. And
call them out.
Archives disappear from government websites. But since Annalisa mentioned, I did want to give a shout out to Ryan Ozawa and all of these other groups that during the pandemic, community organizations and research groups and groups formed for the purpose of researching COVID for the community's benefit, like the Hawaii Pandemic Applied Modeling Work Group. There were so many of these researchers who may not even be doing anything related to virology or medicine, who came forward to lend their expertise to provide data visualizations and analysis so that the public can understand the pandemic so much better.
Yeah, Yoohyun, I just wanted to mention, you reminded me, the other really good visualization tool that we used was the CARES Act spending. I can't remember the group.
Hawaii Data Collaborative.
Yeah, so we did a couple stories about that, right? Because when it was getting to the deadline of like, why aren't these governments spending this money and where is it going, and CARES Act. So we had, I can't remember her name, the lady who was in charge of that.
Jung.
Yeah, so we had her a couple times to talk about, how the counties were doing, and, what the status report was, and where this money, how this money was being spent. So and that's really kind of like really dense stuff for TV, right? So I think when you have those, really nice charts and things, it was very helpful.
Absolutely. So for those of you who don't know what Annalisa is talking about, the Hawaii Data Collaborative actually has a COVID tracker and a federal CARES Act spending tracker. And it breaks down to, comes with an enormous level of disaggregation. You can see where the money is going and how much was spent when. So please check that out. So that's it for our panelist questions. We want to open it up to the broader group now for you guys to be able to ask questions to the panelists themselves, yourself, I mean. And you can either direct your question at everybody or a specific person you choose. So we will start taking questions now. Anybody want to step forward? Just unmute your mic and start talking.
Hi, I guess I did have a question. So we were just talking about like COVID and how there was like some confusion with the numbers. And I think that doing like a weekly report is like a really smart way to kind of like ease that anxiety a little bit. But I think that goes into like a deeper conversation about like just mis and disinformation going around and like a lack of transparency. And so I guess for like younger journalists, like student journalists, like moving forward, do any of you like have tips on how to like, I guess, avoid misinformation, just because like social media has become like such a like useful resource, but I feel like that's where a lot of like confusion has stemmed, if that makes sense. So yeah, if anyone has anything to say about that.
I would say, for the social media stuff, that's been most helpful to find, like real people, sources, and just they're willing to talk, if they're willing to talk about their life experience. But when it comes to sourcing for other things, it's really important to do, background checks. And that can be like, if you're short on time, a Google search just to make sure, okay, is this person legit? And I think that sometimes it's good also to seek experts from out of state who can provide, maybe a little bit more of a bird's eye view on what might be happening in Hawaii. That's always helpful as well.
Okay, thank you. Yeah, just because like I read a lot of things, like especially like on Twitter and like Facebook and Instagram, and then I'm reading something else that says like something way different. So it's like sometimes you just never know. So I guess, yeah, that is really helpful to just like check in with experts and maybe triple check through other research and whatnot. But yeah, that's really helpful. Thank you.
Yeah, that kind of reminds me, I think you definitely want to get like a diversity of opinions too among different types of experts, because like an economist is going to tell you one thing and an epidemiologist is going to tell you another. And so, that'll definitely strengthen your reporting too, just to include a variety of voices, because a lot of people might have very strong opinions about certain things, and they might be an expert in their own particular field, but their argument could be picked apart by another person who is a virologist, for example. So as long as you have a diversity of voices, I think that can sort of help foolproof things for you. In terms of looking for like the scientific facts about COVID, I use CDC website when I have to. It was weird because in the beginning of the pandemic, the CDC was very slow to put information online, or make sort of like, wide-reaching like national guidelines and decisions and that sort of thing. So I think we're at a point where you could definitely rely on them too. And they have a whole communications office as well.
So in terms of just determining, looking at social media groups and determining which posts or which posters are legit versus not, I think we all have to use our judgment, but the safe thing is, are they willing to give you their full name? And do they have an agenda? Are they affiliated with any organizations that might want to, push an agenda versus not? And often we do talk to organizations that have an agenda, but just to make sure that they're not fabricating anything for their agenda. And that you just have to use your judgment. You have to know their names and who they're affiliated with. And these are basic questions that we would ask any source in any story.
Yeah, and I think like the thing I wanted to add was that, when you use an anonymous source, they're not anonymous to you. They're anonymous. Like, we try to not use anonymous sources, but if you need to use an anonymous source, that doesn't mean that the reporter doesn't know who they are. In fact, you might, like, I think if you're using an anonymous source as a reporter, it's like your job to know who they are, not necessarily if it's something really delicate. It doesn't necessarily need to be public, but you should at least know who they are, so you can know that they're legit, or they're, at least gauge it in some way to figure out, why they're telling you what they're telling you. So yeah.
Thank you.
Annalisa, did you want to add anything?
No, you guys pretty much summed it up. I mean, the only other thing I would add is just make sure you corroborate your information. So if someone is claiming something, you just ask other people that may know about it to make sure. You just have to have multiple sources confirm what you think that person is saying. That's all. Even if it's just important because especially when you're dealing with people who want to be off the record or not off the record, like background or stuff like that. You just have to make sure that you can find other people who can verify that.
Thank you so much. We'll take another question. Anybody want to step up? I can't pick on the audience. Do we have a question from Jason?
I think Wes is raising his hand.
Okay, Wes, go ahead.
Okay, yeah, I know there's a faction out there that asks whether, these numbers especially and tickers and whatnot is, motivated by what they call fear mongering. I know Hawaii News Now, comes out and says, facts, not fear. They have their slogan out there. But how does each of you counter those who accuse the media of using COVID as, just fear mongering and creating fear in the public?
Gonna pick on Ashley.
Yeah, I think when I hear that, I just try to redirect them to my reporting and I say, this person, this was corroborated information from XYZ expert. They're saying this. And I mean, generally, I have not really been I've heard people say that about national media, but I haven't personally been told that about my reporting. And then honestly, like if they're just like commenting on your story on the internet or on Facebook or something, it's just like not worth it. Personally, I just choose to not engage because I think the reporting should speak for itself. And and I feel confident in the way that I reported the story, that it was fair and accurate, and I talked to a bunch of experts, corroborated everything. And I think if you're still come to that conclusion, like there's not much more that the reporter like me that I can say to deter you from that. But.
Did any other panelists want to answer that question?
Well, I can talk a little bit about it. I know because TV will get viewers who will say, oh, the fact that you're reporting about COVID still, it's just the flu and you're making it out to be a lot more than it is. We're always going to get people that say that, right? And that we're just aiding to the fear mongering and the what's the other claims they make, that the vaccinations are benefiting these huge corporations and it's all conspiracy. We're always going to get these types of people that that question that. But like same as Ashley said, if I haven't got a personal attack on a report that I've done, because I feel like we do our jobs as journalists, and have our own standards. So I don't know if they're just again trying to further their agenda by attacking us, but I don't engage either. We don't really engage either, and I feel like we aren't sensational, at least at my station. I don't know about other stations.
I would just add that it's important to include links to your sources in the text of your article, and we can do that online pretty easily. So it's just like right there for readers to click on and learn more. And that's super important in building trust with your readers.
We have a question from Suvan.
Yeah, so I was curious, what do you guys think about how certain reporting aspects have like totally changed during this pandemic, in the sense that we may never go back to how it was before? Do you guys have any thoughts on that? Like, what are some processes that we've now turned to that will just be permanent? I mean, I think one aspect could be this, remote work function of our jobs, but are there any other aspects of your roles that you found will be, here to stay now that we've done this for about over a year?
I hope they don't keep that press conference format. Like, that is the worst. Like, I wish press conferences are in person again. But I don't know. I mean, they can always just blame COVID and say we're not going to have them in person, because it does kind of, you don't get that urgency to get your question in, right? Like, where they can't just ignore you or mute you. So I hope that doesn't stick around.
I feel like people are more and more, I think people will continue or still want to do more phone interviews. Like, I think it'll become less of a practice to be like, to show up at like the city councilman's office or the state legislator's office. Like, I think that that's something that's probably not going to be, I hope it's not that way, but it feels like that's something that's not going to be as accepted as it once was, where you could kind of just like show up or run into them, randomly, or like wait for them after the press conference and grab them on the side. Although I will say like some of that's changing a little bit. Like today, I went to a press conference in person for the mayor, and I could do some asides with some people, and it kind of felt like normal. But it's increasingly rare to do something like that. And I hope it's not to stay, but I think it's very possible. I hope they continue live streaming everything though, because that's really helpful in its own right. Yeah, and like especially like all the council meetings and whatever, like super helpful to just have that live stream going in case you actually like couldn't make it out there or something. At least it's documented somewhere that you can go back and look at it, or you can like do two things at once or whatever.
Amen.
And I feel like it's helped with our reporting on the neighbor islands for sure. Like, because we can't go there, right? So I've been able to interview people on every island, right? Even Lanai. So I think that's important. And we didn't have that before because we couldn't go there, or we didn't know how to find them. And I think to your earlier question about social media, I mean, that's helped identify people on those neighbor islands when, you can't actually physically go, but you can reach out on these forums and these groups. So I think that's good. I think that's here to stay, like being able to talk to people on the neighbor islands more easily.
And this to remote working as well, right? So like most of us journalists were working remotely. So kind of spinning off of Suvan's question, is remote working better for media? Or, I mean, not when you need to go and make shots, I guess, for television, but or is being in the office a more like a conducive environment?
Well, I miss the camaraderie of journalists. So, I mean, I stay home for my job in the mornings because of children duties, but I do go to the office because I feel like just being around other journalists, it inspires and it just kind of keeps you focused as opposed to like if you're at home by yourself with the screen. That's just me personally.
Yeah, I think the most ideal situation would be like half in, half out. I do like working from home because one thing that I like really hated when I worked in newsroom is like that everyone can hear you talking on the phone and you can kind of hear everyone else. I'd be a little self-conscious of people like hearing me interview people or having conversations because I'd be like, oh, was that a really dumb question? Did everyone hear that? Or was that really weird? Did everyone hear that too? Or I just get distracted. Sometimes I'd be talking on the phone and just like overhearing someone else and just be like, wait, what was I even talking about again? So it's nice to have a more private space to conduct those interviews, but I do miss like bouncing ideas off of people. I think that that's not as common anymore that we work from home, and the staying focused thing is a lot harder too when you're at it full time at home.
So true. Jason, is your hand raised because you're going to ask a question?
Yes.
Go ahead, please.
My question is, since we're more than a year into this, and as they say, hindsight is 20/20, is there anything that you would have done differently in the past year, reporting wise? And aside from wearing a mask at that last press conference and probably not being next to everyone, aside from that, what else? Is there anything else you would have done differently during the last year of reporting?
Trying to take
Buy
better care of myself.
GameStop stock. Just kidding.
Yes, that.
Oh, we're talking about other reporting. Sorry.
I missed it. Savon, what did you say?
I said buy GameStop stock.
Oh.
I'm just thinking of how so much has happened this past year. I mean, aside from COVID, with events and movements, and yeah.
I think I wish because I had heard of, and all of us I'm sure heard of the coronavirus when it was happening in China already. And this was like in November or something. And because I'm still connected to all my because I used to report in Singapore and in the Philippines, so I already kind of knew what was happening. I think in hindsight, I would have started reporting right away and saying that this was happening in other countries, you know, that we're talking about it. And I would have sold it a lot harder to my editor. I would have said, we need to start covering this now, as opposed to waiting till when did we start covering? Like February, March. So, but there was already kind of talk about what was, you know, these other countries shutting down and it getting bad early on. So I probably would have done that.
Any other panelist?
Maybe would have kind of paced myself a little bit better, especially in the summer months. I think like we were all still going like really, really hard when maybe that was kind of like the time to breathe a little, but instead I just kind of like barreled through it anyway. I think it would have been good to kind of like pull back a little and just like reevaluate and I mean, like a big reason why I moved to the Advertiser was because I was really tired of covering COVID full time all the time. And so it felt like it feels a lot very refreshing to not be constantly on the COVID beat anymore. Yeah, so I think like maybe the pacing would have been more ideal at that time.
Yeah, I was gonna say something similar, and it's kind of weird because I feel like on the one hand, I wish I was able to do more stories that just went deeper than just the daily grind. And we had to, you know, cover so many news conferences that came up, which are very important, of course. But yeah, I kind of like wish that I could have done more. But then at the same time, I like thinking back, I should have tried to take better care of myself too and stop being such a workaholic. So that's not a really good answer, but it's like something to reflect on as we move on in our careers and lives.
Thank you for your answers. And, you know, like we, as journalists, we always want to do better on our stories all the time, right? And I think, you know, honestly, if I were to chime in, I would say I wish I had more data. And I cannot say that enough. And you guys would all agree, more data about COVID that accurately reflects which communities and which people are most adversely affected, and you know, who is able to get treatment versus not, who is able to get vaccinated versus not. We still know very little about how that data breaks down. So if you just see, oh, you know, like 30% of Kauai is vaccinated, then it looks really great. But you don't know who of those people are actually people who need it most.
We need a map for that.
Yeah, Ryan, get on it.
Is he? He's not on the line anymore. You should tell Ryan to make a heat map on that.
Sure. Anybody else have any questions? Suvan has another one.
Yeah, I was curious. So it seems like we have some, for the non-journalists on this panel, I assume that they're listeners or readers or, news consumers, because you're obviously interested in the subject. That's why you're here. So I was curious for the reporters here, how has your relationship to your readers changed during this time? What kind of feedback are you getting? Are you getting a lot more feedback? Are they emailing you more? Are they sending you a lot of tweets? How is that informing your reporting? Is it overwhelming? How has that dynamic shifted for you guys? It's curious to know.
Yes, for sure. I've been getting so many more reader emails. A lot of times the positive feedback was what fueled me, really. Just getting like thank you emails for like covering this or explaining this, and that helped keep me going. But then there's of course, trolls or even public officials might like respond more than they used to. So I think overall, yeah, I think engagement like one-on-one by email definitely went up for me.
I kind of felt like people were more like they kind of thought that they knew you more, like they were asking you more questions, like as if you were, which most of the time I'm happy to answer, so it's fine. But it's just I thought it was really interesting. Like they would be like directly like on Twitter or something like at Ashley, what is going on with XYZ thing? And I would be like, that's kind of strange. Like I've never really experienced that. It's not much more common. It's more they felt as though they wanted to have like a conversation or like have a back and forth of like what's going on, which I thought was really interesting. And I feel like people are just like a lot more engaged. Yeah.
Annalisa, do you have anything?
Yeah, same with me. People are definitely emailing me directly now because they feel like I'm writing a certain type of story, right? Like I mentioned earlier that I was like on the quarantine beat for a while. So people were sending me tips like, oh, this person is bragging about this and this and this and needs to be held accountable. And, so they'll find you because of your reporting and start talking to you and telling you your story. And also like anyone with unemployment, because I was covering that for a little bit too. So people were messaging me about, please air my story because, I'm not getting anywhere with DLIR. So stuff like that. And I'll help. Oh, and I remember early on, there was issues with disabled people not getting food, right? Because we were all on lockdown. So I did a bunch of stories about what the government was doing with SNAP and being able to get delivery to these people that are homebound or just are immunocompromised and can't go out and do groceries. So these were all people just emailing me and asking for help. And so I appreciate that, right? Because I can't go out and find them. So the fact that they were coming to me, I was like, yes, please email me more, send me more tips, because otherwise it's like, I don't know how else to find them.
Yvonne, did you have anything else you wanted to ask?
No, I was just to chime in as a reporter myself. I was just struck by how many like parents would email me sort of kind of venting about like, what is going on? Why isn't my kid's school reopened? Can you please look into it? And just really kind of unloading their personal situation onto a reporter who would listen or perhaps even respond back. And, I think that is one thing that has changed in my sort of interactions, with readers, is that they kind of turn to you as sort of a source of just kind of airing their frustrations, because no one on the education or state official side is responding to them. So, you kind of have to sympathize and empathize at the same time, try and give you as much information as you know and give it back to them to be at least helpful, right? So, yeah.
Yeah, definitely. I think that they felt like they know their voices aren't heard. Like they
Mhm.
write to lawmakers or they write to everyone and anyone, right? But then if they write to us, like I'll make an effort to reply, and then they'll say thank you so much for replying, and blah blah blah. And so you kind of have to help, right, when no one gets any answers.
Mhm.
Yeah, and you know, absolutely, like journalism is a public service, and this is why we this is why we do it. Actually, I just got a question via direct message from Jay. So I will share that question with you, and that'll be our last question for the evening. He said, several of your panelists have worked elsewhere. How does the Honolulu experience compare to what is happening in other cities, countries? Okay, Annalisa, since you worked in Singapore and Philippines, I want to hear from you.
Okay. Yeah, no, everywhere I've been, I felt like this, again, it's all perspective, right? So I feel like it's harder to get people to talk here. It's again, I don't know if it's a stigma or if it's the 2 degrees of separation and everyone doesn't want to be judged by their circles of friends, but it's been challenging to try to get these stories about people that test positive, some of these nurses that work or that are really, on the front lines of this early on. Well, whereas when I talk to friends who are on the mainland or whatever, or even in other countries, they have tons of these stories, right? And I don't know why I couldn't find it. I don't know. Did you guys have any luck? Especially the healthcare workers, like that, the fact that you can take cameras into the hospital during COVID, right? Some of these people would film their COVID response experiences, some of these doctors, and they'd be crying and sharing these like horrible stories. I didn't really see that here.
Yeah, I would agree. Like, I think people here were less, like, in the healthcare community, like, it was less, but I think that also had to go with, not to downplay the virus at all, but I think in Hawaii, I think the hospitals, we weren't reaching like those levels that we were seeing in like Los Angeles or like New York. And so I think maybe while it was hard, it wasn't at that critical level where they felt as though they needed, like, I feel like when people talk to journalists on the record like that in those vulnerable situations, it's kind of like their last ditch effort to be heard. And I think like maybe in Hawaii, because the virus didn't get so out of control in the way that we saw in like these other big metropolitan cities, that the people were not at that critical point level where they felt like they needed to turn to journalists to be heard. Well, I mean,
the veterans home was bad. Remember?
Yeah.
That was bad.
That was really bad.
And I couldn't get someone to talk. I did find someone who talked about it, but she chose, I mean, that was a good story too, where she was a nurse that worked at the hospital, but her grandfather had died because he was in there as a resident. So she was trying to be a little bit PC about the whole thing, like not criticize the practices there that made the outbreak worse.
Thank you for sharing. I'm sorry. We want to squeeze in
one
last question because we have one hand raised and we wanted to accommodate. And we'll very quickly answer that question and then wrap up. Matthew, go ahead.
Hi, sorry, I don't mean to extend the session here. And I actually didn't have a question. I'm not a journalist. I'm on the other side of the process as a communications director. So it's often a challenge to get media interested in issues that we think are vital to the community. But having worked in public health for 20 years now, that's usually been an uphill fight. So COVID's been kind of a double-edged sword because now I can get phone calls and emails returned relatively quickly. But on the other hand, we're dealing with this global pandemic. I just wanted to say that from our perspective, just being so appreciative of how some of the folks, and Eleni is definitely in this category because we've worked with her, but extremely appreciative of the very thoughtful way in which the stories have been approached, in particular here on Oahu. Not just that we have hotspots like Kalihi, but why these areas were experiencing these infection gradients. So taking these very complex issues and spending the time to report it very deeply, to me, those were examples of, finest examples of the power of media to do the public good. So just on behalf of people in public health, I just want to thank all of the journalists for all the work that you've been doing for the last 16 months. So thank you.
Thank you so much for sharing that, Matthew. Anybody want to say anything to Matthew before we wrap up?
I'll call you for a source.
Yeah, thank you.
What's your cell phone number? I'll call you now, Matthew. I'll get more information from you too.
Okay.
All right. Thank you, everybody. We had Eleni Avendaño from Civil Beat, Ashley Mizuo from Star-Advertiser, formerly HPR, Annalisa Burgos from KITV. My name is Yoohyun, data reporter at Civil Beat. Thank you so much for joining this webinar by Asian American Journalists Association's Hawaii chapter. We will see you guys around. Send us an email. Thank you.
Bye, guys.
Thank you.